Your nose is one of the most important features for facial attractiveness. If you look at top models, almost all of them have a nose which is well proportioned to their face. Because of this, having a smaller or more refined nose becomes a goal for a lot of people. But the part that almost nobody tells you is that your nose probably isn't too big. In fact, I've done consulting calls with a number of young guys who believe that their nose was their biggest flaw. But when I actually measured their face and broke down their anatomy, what I found is that their nose wasn't actually oversized at all. What was really going on is that their jaw and their cheeks didn't project forward and outward enough. And so in comparison, their nose did look bigger. And this is actually a mistake that a lot of people make when judging their own appearance. In this video, I'm going to show you the exact metrics that determine whether your nose is harmonious, how to measure them, the underlying anatomy behind it, and the different treatment options that exist to improve it based on the anatomy. Now, as a quick disclaimer, this video is for educational purposes only. For any medical treatment, always make sure to consult a qualified professional. An ideal nose is not just one with an appealing shape, but it's also one that is well proportioned relative to the rest of the face. And to measure that, there are 11 metrics that I want to go over. 5 for the front profile and 6 for the side. For each metric, I'll show an example of it on screen, but if you want the exact landmarks and ideal ranges, I organize all of it into a database, which you can access for free inside my school community, which is linked in the description. So for the front profile, we have the ipsilateral alar angle. This measures mid-face convergence and the height of the nose. It tells you about whether the nose is too short or too long, and it can be used to tell you whether the nose has good vertical proportion relative to the face. The nose bridge to nose width ratio tells you about the taper of the nose. If the upper part of your nose is too narrow, it makes your nose look too triangle shaped, and if the upper part is too wide, it makes it look too rectangle shaped. And a nose that falls within the ideal range is going to have a very nice taper to it. The intercanthal to nasal width ratio tells you about how wide the nose is relative to the eyes. Ideally, you want the width of the nose to fit in between the eyes. This is actually a very common way to determine whether your nose is actually too wide. What I will say though is, depending on your phenotype, the tolerance for how far outside the intercanthal distance that your nose can be will vary, but generally you want it to fit in between the eyes. The nose width to face width ratio is going to tell you about how wide the nose is relative to the face. And this is actually the number one reason most people think that their nose looks too wide. It's not so much that the nose itself is too wide, but rather their entire face is too narrow. And so this ratio is very important because it tells you whether the issue is the nose itself or if it's coming from the surrounding bone structure. The height to width ratio tells you about how tall the nose is relative to its width. And it also tells you a bit about the position of the radix, which is where the bridge of the nose intersects the forehead. This will tell you about whether the nose is too compressed or too stretched vertically, and it does correlate with the ipsilateral alar angle. Now, for the side profile ratios, we have the nasofacial angle. This will tell you about the pitch of the nose relative to the face. So it will tell you whether your nose is sticking too far forward or if it points down too far. The nasal tip rotation angle will tell you about how upturned or downturned the tip of the nose is, and this is the number one reason why some noses look like they have a droopy tip. The nasal width to height ratio will tell you about how far forward your nose projects relative to its height. So it can tell you whether your nose is too tall and short or if it's too short and pointy. And it's pretty useful for distinguishing between different kinds of disharmony. The nasolabial angle will tell you about the pitch of the base of your nose, and it will also tell you about how much nostril exposure you have. Because when the tip or when the base of the nose, it points too far upwards, then the cartilage in the front that is normally supposed to cover your nostrils is going to be lifted, which is going to give you more nostril exposure. The nasal tip angle will tell you about how refined the tip of your nose is, and it can be used to determine whether your nasal tip is too round, too pointy, or if it's ideal. The nasomental angle will tell you about the projection and the convexity of the nose relative to the chin. Because it uses the chin as a landmark, it's going to depend a lot on how far forward your chin projects. And this is one of the biggest reasons why the nose can look too big from the side, even if it's properly proportioned, because the chin is supposed to act like an anchor for the bottom of the face. And so when the chin is set too far back, it makes all the features above it look bigger by comparison. And because the nose is positioned in the middle of the face, it will make the nose look bigger. Before we can talk about improving the nose, we need to understand the anatomy, because what will often happen is people will blame the nose for a disharmony that is actually being caused by another part of the face. Because most of the harmony metrics are measured relative to other parts of the face, seemingly unrelated features can actually affect how harmonious the nose looks. And there are actually 8 main pieces of anatomy that affect how the nose looks. The first one is going to be the maxilla, which is this yellow bone right here. You can actually feel this bone on your face if you take your fingers and feel just below your eye here. You're going to feel like a hard ridge. That's going to be your maxilla. This bone forms the upper jaw, the base of the orbital floor, and also the base of where the nose sits. The maxilla is going to determine the height and the projection of the nose, and also its overall position. So having a maxilla that is positioned well and well projected is going to make the nose be more structured and have better projection. The second piece of anatomy is going to be the mandible, and more specifically the chin. On the skull here, it's going to be this beige bone at the bottom. You can actually feel this bone on your own face if you take your fingers and feel just underneath your lip. There'll be a hard ridge there. That's going to be the mandible body, or more specifically the mental process, which is also known as the chin. Now, like I said before, when the chin is well projected, it's going to create a strong anchor at the base of the face, which is where all the other features are going to be measured relative to. And so when the chin projects far enough forward, it's going to make the features above it look smaller, and when the chin is recessed, it's going to make the features above it look bigger. And because the nose sits right above the chin and the mandible, the nose is going to look bigger when the chin becomes recessed. And this is the number one reason why people think their nose looks too big from the side. It's actually, more often than not, that their chin and their mandible is recessed. The third bone is going to be the zygomatic bones, which are these purple bones on the side here. You can feel these on your own face by taking your fingers and positioning them just down into the side of your eyes. They'll be like a hard ridge right there. That's going to be your zygomatic or cheekbones. This bone is going to determine the width of your face, and it's also going to determine the projection of the area right under your eyes. When the cheeks project outward and forward enough, they're going to create a strong transverse anchor on the face. And that's going to make the features in the middle look smaller by comparison, specifically the nose, because it sits right in the middle of the face. And this is actually the main reason people think their nose looks too big from the front. It's not that the base of the nose or the nose itself is too wide, it's that their cheekbones are too narrow, they don't project outward and forward enough, and so that makes the features in the middle look bigger by comparison. The fourth bone is going to be the nasal bone. On the skull model, it's going to be this light purple bone right above the maxilla. You can feel this on your own face by taking your fingers and positioning them right in between your eyes. There's going to be like a hard ridge here. That's going to be your nasal bone. Like I said, this will determine the pitch of the nose, how upward or downward it's turned. It's also going to determine whether or not you have a dorsal hump. So if you see a nose that has a bump along the ridge of it, that's going to be caused by a combination of the nasal bone and nasal cartilage. This bone is also going to determine the position of your radix, which is going to affect how tall or short the nose is, and also how much depth you have in between your eyes. And it's also going to determine the width of the upper part of your nose, which is going to affect the taper of it. The fifth bone is going to be the frontal bone. On the skull model, that is this blue bone right here. You can feel it on your own face by taking your fingers and feeling just above your eyebrows. This hard ridge is going to be your frontal bone. This bone is going to determine the nasofrontal angle, which is the angle between your brow ridge and your forehead and the bridge of your nose. A frontal bone that's well projected is going to create a break between the planes of your forehead and the planes of your nose. When the frontal bone doesn't project forward enough, the plane of the nose and the forehead are going to blend into one, and that's going to make the whole profile of the face look a lot weaker. Now, the sixth piece of anatomy isn't something that I can show on the skull because it only has bones, but it's going to be your lateral cartilage. So if you feel along the edges of your nose, there's going to be like this squishy thing that forms the outer border. That's known as lateral cartilage. This is going to affect the width of the nose and also the breadth of the nose, so like how far out it flares. Now in a similar area, if you feel in between your two nostrils, there's going to be a soft barrier that is separating them. That's known as your septal cartilage. Your septal cartilage is going to determine how symmetrical your nose is. So if your nose veers to one side a little bit, that's almost always going to be caused by asymmetric septal cartilage. And the eighth piece of anatomy is going to be your nasal tip cartilage. So if you feel on the tip of your nose, there's going to be a soft but firm structure there. That's going to be your nasal tip cartilage. This is going to determine a little bit the projection of the tip of your nose and also how round or sharp it is. Now, one thing I want to say about the symmetry of the nose is although the septal cartilage is going to affect how far it deviates to one side or the other, it is still going to be influenced by the symmetry of the underlying bones. So if your maxilla veers to one side, then your nose is also going to veer to one side. Also, if the bone that the septal cartilage attaches to behind the maxilla, which is known as the ethmoid bone, if that veers to one side, then that's going to make the septal cartilage also veer to one side, which is going to make the nose look more asymmetrical. So, let's talk about how to improve the nose. The first step that you're going to want to do is gather data on it, because your eyes are very good at knowing whether something is off, but they're very bad at determining what exactly is causing the disharmony. And for that reason, if you want to improve your nose effectively, you're going to want to get the numbers. Once you have the numbers, your goal is going to be identifying what part of the anatomy is causing the disharmony, and then whether it's better to target it directly or if you can camouflage it. And so I'll divide this section into Softmaxes, minimally invasive, and Hardmaxes. Different solutions are going to target different causes, and the right one for you is going to depend on the underlying anatomical cause and how comfortable you are with the different options. And so starting off with the Softmaxes, the first one is going to be your diet. The way this is going to work is by improving your diet, you're going to reduce your body fat levels, and you're also going to reduce bloating and inflammation. Now, the way this is going to help is when you have too much adipose tissue or you have too much water being retained in the face, it's going to round out the angularity, and it can also alter the ratios of your face. A lot of the times this is going to make your nose look more puffy because the surrounding fat pads are going to fill up with adipose tissue, and they're going to fill up with water, which is going to make them bloat outwards. And so by improving your diet, you're able to reduce your body fat percentage, you're able to reduce your water retention, and you're able to reduce your markers of inflammation, which is going to improve the angularity of your face and make your nose look more harmonious. Now, the second technique is going to be Accutane. Now, interestingly enough, Accutane isn't actually prescribed to make your nose slimmer. Accutane is a prescription drug that is used to reduce the size of sebaceous glands, which is used to treat acne. Now, because your nose does have sebaceous glands on them, which are the glands that produce oil, when Accutane reduces the size of those sebaceous glands, it's going to make the surface of the nose shrink, which can make it look a little bit slimmer. Accutane also reduces inflammation in the skin, so if some of the excess width is coming from inflammation, then Accutane will reduce that, which can again make the nose look a little bit slimmer. Now, you don't want to take Accutane specifically to make your nose slimmer. You should only really take it if you're using it to treat acne. It's more like just a bonus effect that comes along with it. Now, the next Softmax is going to be your haircut and hairstyle. And there's going to be two techniques in particular that are going to help more. So the way you can use your hair to fraud the width of your nose is going to be by redirecting attention and by making your whole face appear wider or narrower. And so the way you can use hair to fraud a slimmer nose is by redirecting attention outwards and making the face appear wider. So the first technique in particular is going to be having longer hair in the parietal region. On the head, there are different regions that have different names. For example, the top of your head is going to be called the crown, and the parietal ridge is going to be this area along the sides here. When you have more length here, it's going to make the width of the top of your head greater, and it's also going to improve angularity. This is especially true if the rest of your face is rounded. A lot of the times what you'll see, if someone has a overly rounded face and they get a haircut that cuts really short in the parietal region, it's going to make the top of their head look even more rounded, which is going to worsen the effect instead of improving it. The second technique is going to be curtains. So if you have longer hair, you can let it fall along the sides of your face, and what this is going to do is it will cover up your cheekbones and it will make the face appear wider. So if your nose dominates your face because your cheeks don't project outward enough, then this technique can help make your cheeks appear wider, or at least covering up where the border of your cheek is, which can indirectly affect the apparent width of your nose. Also, the curtains just draw your attention towards the outside of the face, which is going to reduce how much focus you're giving to the middle. Another softmax is going to be glasses. So the way it works is it's going to create a frame around your eyes and your mid-face, and that's going to draw attention towards the eye area and the glasses, which is going to pull attention away from your nose, which can be a good way to help distract from a nose that isn't properly proportioned. Now, a technique that's going to work for men specifically is going to be facial hair. If you have hair at the bottom of your face, it's going to make your jaw look like it projects forward and outwards more, and what this is going to do is it's going to create a stronger anchor at the base of the face. Since some harmony metrics of the nose are measured relative to the position of the chin, if you're able to create more chin projection, more jaw projection, then that's going to make the nose look more balanced in comparison. Now, another technique that works is makeup. This is going to work better for women just because they can get away with it more. But if you're able to do it in a really skilled manner that it's not even detectable, then men can also use it to their benefit. So the way it works is it's going to paint highlights and shadows on the nose, which is going to change the apparent contour of it, which can make it appear slimmer. Now, a more advanced technique is going to be prosthetic makeup. So what this is it's sculptable silicone pads or a similar material that you glue onto your face and then you mold into the shape that you want. Now, of all the softmaxes, this is the only one that can meaningfully simulate real structural change without surgery. And that's what makes it such a powerful technique. I mean, if you've ever seen those videos of, I believe it's usually like Korean women, where they look pretty good, they look like they have makeup on, but they do look good. And then they take off like 10 layers of makeup and they look like a completely different person. Now, the technique that they were using is prosthetic makeup, along with traditional makeup in order to blend the edges of the silicone in. Now, for minimally invasive techniques, you're going to have a few more options. So the first one is going to be filler. This is basically going to be something that you inject underneath your skin, which is going to create more projection in specific areas. Now, some injection sites that will affect how the nose looks is going to be cheek filler, chin filler, and nasal tip filler. By making the cheeks wider, you're able to make the nose look narrower in relation because the base that it sits on gets wider. With the chin, when you increase projection, you're going to make the nose look smaller because you'll have a stronger anchor at the bottom of the face. And if the tip of your nose is too flat or it doesn't project forward enough, then some filler can modestly increase projection, although I don't think nasal tip filler is a very common site for injections. Now, a few things I want to say about filler is that it is not permanent and there is also risk of migration. So if you see celebrity plastic surgery cases where instead of looking better, they end up looking uncanny, most of the time that's going to be because they were using too much filler. So what happens is you get filler the first time and it creates a projection where you want it and it looks really good, but filler is not permanent and it will slowly go down in concentration. So if you want to retain the effect, you'd have to get it injected again. But when you do that, it slowly starts to migrate to different areas of the face. And so instead of having projection in the areas that simulate bone, that filler, which is soft, is going to migrate to other areas of the face, which is going to make it look really puffy and unnatural. Now, some filler can be dissolved like hyaluronic acid, but when you're dissolving it, you're also dissolving the natural hyaluronic acid in your skin, which can cause some unwanted side effects. Now, for some other minimally invasive techniques, these are going to be functional orthodontic appliances. So the first one is going to be a palatal expander. So what this is used to do is expand your upper jaw, your maxilla, and that's going to make your upper arch wider. It's going to expand your airways, and it can be used to correct a narrow upper arch and a crossbite. But with certain expansion techniques, it actually pushes the cheekbones outward a little bit, not much, just by a couple of millimeters, which can make the mid-face look wider. And because the mid-face gets wider, it can make the nose look a little bit slimmer because, again, the base that it sits on gets wider. Now, one thing I do want to say about palatal expansion is that I do believe it also makes the nose a little bit wider by like 1 or 2 millimeters. So the width coming from your face might be canceled out by the extra width of your nose. But then again, it will depend a lot on the specific anatomy of your skull and how much expansion you do. Now the second appliance is going to be reverse pull headgear. Now what this is an external appliance that is used to move your maxilla forward, and in some cases move it downwards a little bit. Now the reason why it can help with your nose is if your maxilla is under projected, then moving it forward into a more ideal position will correct where the nose sits on the face, which can make it fit more harmoniously with the rest of your features. Now lastly, we're going to be going over the Hardmaxes, and all of these are basically going to be different techniques of plastic surgery that will directly target the anatomy and correct the markers of facial harmony that will improve the aesthetics of the nose. So the first one is going to be rhinoplasty. This is a surgical procedure that directly changes the nose. It can affect the width of the nose, the contour of the nose, and the rotation of the tip of the nose. And this is going to be something that will be highly effective if the disharmony is coming from the nose itself. Dorsum implants are going to be small biocompatible implants that are placed along the bridge of your nose. These can be used to increase projection and height of the radix, increase projection of the nose body, and increase projection of the tip. This can be useful when the nose is too flat and when it needs more structural presence. Genioplasty is a surgical procedure where they cut along the front of the mandible, which allows them to move the chin forward, or in rare cases, move it backwards. It also lets them adjust the height of the chin, depending on the specific case. This is going to allow you to increase chin projection, which will create a better balance between the nose and the chin in your side profile view. Similarly, you can also use chin implants to achieve the same effect. Cheek implants are going to use a biocompatible material to simulate bone projection in your zygomatic area. What this can do is it can increase outward and forward projection of the cheeks, which is going to create a much stronger anchor, which can make your nose look less dominant in comparison. A frontal implant, again, is going to be a biocompatible material that will increase projection of your forehead, and this can be used to create a separation between the planes of your nose and your forehead, which can make your whole side profile look a lot stronger. Now, if you needed to go in the opposite direction, you can use frontal bone contouring, which is where they'll shave some of the bone off of your forehead. And what this can do is it can decrease an overly projected brow ridge, which is a very common technique in facial feminization surgery. And it can also improve the transition between the forehead and the nose, which will improve overall harmony. And it can also change the slope of the forehead, which again will improve the side profile harmony. Now, the last surgical procedure, which is probably the most powerful of them all, is going to be a bimaxillary osteotomy, also known as a jaw surgery. And the reason it works is what it does is it cuts and repositions your upper jaw and your lower jaw, which allows you to move it forward, up and down, rotate it, or change the inclination of it. Since the nose sits directly in front of the upper jaw and the size of the nose will be measured relative to the mandible and the chin, when you're able to move the skeletal base around, you're able to completely change the skeletal relationship between all the features. And so if you were to use something like that, you'd be able to correct so many different markers of facial harmony all in one surgery. A lot of the time when the nose looks too big on a face, it's because the surrounding bone structure isn't projecting far forward enough. And so when you're able to move the underlying bone structure, you're able to change the entire context around the nose that's making it look too big. Now, most people will never pursue surgical solutions, and that's completely fine. The important part is understanding the underlying cause of the aesthetic effects that you're seeing. So to recap, the apparent size of your nose is influenced by parts of the face that are seemingly disconnected from it. Those effects can be estimated with measurable front and side profile ratios and angles, but those ratios and angles are only indicators, and the real cause always comes back to anatomy. In most cases, the biggest drivers are the maxilla, the mandible and chin, the cheekbones, and the surrounding soft tissue and cartilage support. Because of that, solutions also exist on the spectrum. Some of them will only change the perception of those ratios, some will improve the surrounding structure, and some will directly target the nose itself. Now, the goal of this channel isn't to tell you what you should or shouldn't change, it's to help you understand what's actually causing the aesthetic effects you're seeing, so that way you're able to make informed decisions instead of guessing what's wrong. And if you're someone who values clarity, anatomy, and understanding how all these systems connect, then you can join my school group for free, where I put the database, my private notes, and the breakdown of all the stuff that we just covered. And so if you'd like to access that, the link to it will be in the description.